So, Dr. Fauci, Wisconsin is one of the hardest hit states by the coronavirus in the country right now. If we stay on this current track, what should we expect in the next few weeks?
Well, unfortunately, if we stay on this track, things are going to get considerably worse, particularly as we get into the holiday season where people will naturally want to congregate with family and friends, a natural instinct to do that. We're going to have to take a look and do a risk benefit determination. Each family unit needs to do that about getting people in closed places indoors with, when you have the typical traditional beloved Thanksgiving meals and Christmas meals. We're going to have to take a look at in our own families when you have people who might be of a high risk of a serious outcome of either elderly or with underlying conditions. Is it wise and prudent to have the kind of traditional celebrations that we do? So that's one of the things that you could address. I mean, everyone is so much worn down with COVID fatigue at the same time as you have situations where just the time of the year is going to put us in a more precarious situation, that we just have to be careful to do some of the things without shutting down the country, without, completely locking down again, to make sure everyone does the fundamental baseline public health implementation, the wearing of masks, the do not congregate in closed spaces or have gatherings in which you can't but stay close to an individual, try to keep distance, do the kind of things that we talk about all the time. I mean, they're very simple. Masks, distance, crowds. Those are the things you've got to be careful of. I know when we say that, people interpret that as wanting to shut down. You can still keep certain businesses and many businesses open while still maintaining these public health measures. It's not that difficult to do, even though we're all fatigued with it. One good thing that's on the horizons is that help is on the way with vaccines, because we have 2 vaccines that are extraordinarily efficacious in preventing significant disease and certainly serious disease. They're going to start being implemented probably by the end of December, and some individuals who are in the high risk categories or frontline people working in healthcare settings will be the first tier likely. We haven't fully decided yet. The CDC decides that together with advisory committees about when you have not enough vaccine immediately to give to everyone, that what's the priority. But soon, within a reasonable period of time, months or so, we're going to have vaccines to be able to give to a substantial proportion of the population. So the message is hang in there, because help is really on the way.
And I do want to ask you about the vaccine, because Pfizer just submitted that application to the FDA for emergency use authorization. So realistically, when could Wisconsinites have a vaccine?
Well, you've got to be careful, because you can't look at Wisconsinites as a unidimensional group. In Wisconsin, you have healthcare workers. You have people who are frontline essential workers. You have people with underlying conditions. You have elderly people. And then you have people who are young and don't have anything that's an underlying condition. So you can't group Wisconsin as a unidimensional group. If they decide in their prioritization that healthcare workers who are on the front line taking care of patients are going to be the priority, you could have people in Wisconsin getting doses in December. And then as we get into January, more. It's not going to be one state versus another state. It's who within the state is in that priority group.
And then in terms of someone who is healthy, but just concerned, when do you think they could get a vaccine?
The projection is, and it's not going to be exact, but I think the projection will be close to being accurate, is that as we get towards the end of the first quarter of 2021, sometime in April, and then as we get into May, June, it'll be more and more people. Hopefully, by the time we get into the middle or end of the second quarter of 2021, we will have vaccinated everybody who wants or needs to be vaccinated. That would be an important accomplishment, because then we could bring down the level of infection in the community to a very, very low level.
And you mentioned one state versus the other a little bit there. And I did want to ask you about that. Does it make a difference in terms of which state get this vaccine first based on their coronavirus numbers?
No, I think it's going to be really based on the susceptibility of an individual group of people to getting infected. But again, I'm not the one that makes that decision. That's going to be an advisory committee to the Centers for Disease Control and Prevention.
I know you've heard some people say they want to wait until the vaccine is out there for a while. They want to see how it goes before they feel comfortable stepping up and getting it themselves. What's your response to that?
That's an understandable reaction. But I think what people need to understand that the process right now of showing efficacy and safety is a sound process done by independent groups who have no allegiance to anyone, not the administration, not the company, not anyone. They're people who have scrutinized the data, a data and safety monitoring board, who then makes that data known to myself, the people in the company, and people in the Department of Health and Human Services. The data then goes to the company themselves. They scrutinize the data. They have an advisory committee called the RBAC. This is a committee that's made up of individuals called VRBPAC, the Vaccines and Related Biological Products Advisory Committee, VRBPAC. They work with the FDA very, very closely and advise the FDA on the process of emergency use authorization. So if something becomes authorized by the FDA to distribute, you can be pretty certain that that's a safe and effective vaccine. If people want to wait until a lot of different people get it, that's their choice. I would recommend, particularly if you're in the higher risk category, to get the vaccine as soon as it is available to you.
And the coronavirus task force just had its first briefing in months, really since August. So who decides whether to have those briefings?
Well, it's a combination. It's generally the person who is the leader of that, the director of that is the Vice President of the United States, who is in close contact with the President of the United States. So it's certainly the decision is made at the highest levels of the White House.
And why do you think there was that long stretch without anything?
I don't know. I can't explain that. I think you'd have to ask the parties involved. I don't want to be surmising about that. I think what it was much more of a pivoting towards trying to open up the country and open up the economy again. And I think that's what was one of the reasons why it veered away from the more frequent briefings. But I
Would
think
you like to have more frequent briefings?
One thing that I think is not fully appreciated is that particularly the public health people who are on that are in constant contact with each other, literally on a daily basis. So even though it isn't a formal meeting of all of the members of the task force, that on a daily basis, I'm in contact with Dr. Birx, Dr. Redfield, Dr. Hahn, Dr. Giroir. That just goes right through, literally on a daily basis.
And just a few more things I wanted to ask you. I think you've worked for 6 presidents now. Any thoughts of retirement?
No, I haven't actually given it a thought. I'm feeling that I'm on the top of my game. We have a very, very serious challenge ahead of us. I don't really see myself walking away from that at all.
And when it comes to the schools around here, I know, are getting very concerned about potential super spreading over the Thanksgiving holiday. Some of them are going virtual for a few weeks. Do you think that's a good idea?
Well, I think, it's not appropriate for me from the outside to go into a local area and tell people what they should do. I can lay down some fundamental principles, is that to the best of our capability, we should try to keep the children in school and get them back to school, for the simple reason that when you look at the infections of kids in school, the infection rate is really quite low. And you have to think of the disturbances to the children themselves, as well as to the families, with the secondary effects on working parents of what that will mean to them. You always have to be very sensitive, always, to the safety and to the welfare of the children and of the teachers. But as a fundamental principle and a default position, you should try to do whatever you can to get the children back to school.
How soon after the vaccine do you think we'll start to get any sense of normalcy again?
Well, that depends on the percentage of people in the population who take the vaccine. You could have a highly efficacious vaccine that's available, like we have, 95% efficacious, but it won't be effective in turning around the outbreak unless you get a substantial proportion of the people get vaccinated. So I would hope that virtually all the population gets vaccinated. If we do that, we'd be able to crush this outbreak for sure. But we want to make sure people do take the vaccine and get over that skepticism about the vaccine.
And Dr. Fauci, when you go to bed at night, what are you most concerned about? What do you lose sleep over with this coronavirus?
Well, before we had the SARS coronavirus 2, the thing that kept me awake at night was the nightmare of actually this happening. So I'm already living the nightmare. So right now, within the context of the nightmare, my concern is that as these cases continue to soar, people don't take it seriously and don't mitigate with the public health measures that I'm talking about. And people don't take seriously the importance of getting the vaccine when it's available. That worries me the most. This is not fake news. This is not a conspiracy. This is a real serious disease.
Okay, well, Dr. Fauci, I really appreciate your time in getting the word out to people who live in Wisconsin. Thank you so much.
Thank you. It's good to be with you. Thank you for having me.